This is Dr. Ajit Kumar Vivekanandan, Assistant Chief Physician, Apollo Ayurveda from Chennai. We are coming up with a masterclass facility with inpatient as well as outpatient therapy in Ayurveda at Greams Road in Chennai at your service very soon. Here we will be attending all general medicine cases, gut health, skin related problems, bone and joint, neck, low back, knee kind of problems, geriatric issues, the old age related issues, neuro problems, different types of migraines, respiratory issues, different type of lifestyle disorders like diabetes and obesity, general health advices wherever it is required. Here we will be having all Ayurveda therapy procedures, whatever is required. Also we will be having a vast range of required Ayurvedic medicines where it is applicable, and we will be at your service at Greams. Hello everyone, வணக்கம் நேயர்களே. நான் டாக்டர் அஜித் குமார் விவேகானந்தன், அசிஸ்டன்ட் சீஃப் ஃபிசிஷியன், அப்போலோ ஆயுர்வேத் சென்னையிலிருந்து. விரைவில் அப்போலோ ஆயுர்வேத் சென்னையில் கிரீம்ஸ் ரோடில் ரொம்ப சிறப்பான இன்பேஷண்ட் ஃபெசிலிட்டியோடையும் அவுட் பேஷண்ட் ஃபெசிலிட்டியோடையும் ஒரு ஹாஸ்பிட்டல் ஆரம்பிக்க உள்ளது. அங்கே நாங்கள் ஜெனரல் மெடிசின் சம்மந்தமாக, உங்களோட ரெஸ்பிரேட்டரி சம்மந்தமாக, உங்களோட சுவாச சம்பந்தமான, அதே மாதிரி தோல் சம்பந்தப்பட்ட நோய்களுக்கு, அதே மாதிரி மூட்டு வலிகள், எலும்பு சம்பந்தப்பட்ட நோய்கள், நர்வ் சம்பந்தப்பட்ட நாடி சம்பந்தமான வியாதிகள், பக்கவாதம் மாதிரியானது, பலவிதமான மைக்ரேன் ஹெட்ஏக்ஸ், தலைநோய்கள் மேனிஃபெஸ்ட் ஆகிற வியாதிகள், நோய் தடுப்பு சக்தியை அதிகரிக்கிற உங்களோட ஜெனரல் ஹெல்த்துக்கு தேவையான, பொது நலத்துக்கு ஹெல்த்துக்கு தேவையான எல்லாவித ஆயுர்வேத ட்ரீட்மெண்ட்டு, அதே மாதிரி மருத்துவம் மெடிசின் தேவையான இடத்துல மருந்தோட வேண்டிய மாதிரி எல்லா வித ட்ரீட்மெண்ட்டும் செய்கிறதுக்கான சிறப்பான ஃபெசிலிட்டியோட கிரீம்ஸ் ரோடில் கூடிய விரைவில் ஒரு மிக சிறந்த ஆயுர்வேத ஹாஸ்பிட்டல் அப்போலோ ஆயுர்வேத் ஆரம்பிக்க உள்ளது. உங்களை எல்லாரையும் அங்கே சந்திக்கிறதுக்கு எதிர்பார்க்கிறேன். வணக்கம்.
Namaste, myself Dr. Susmita, working in Apollo Ayurveda Chennai as a primary physician and consultant. We are very happy to announce that our new facility is starting at Greams Road, which is the heart and central part of Chennai, and we are starting soon with a 20-bedded hospital, and we offer specialty care in various areas. And I am specialized in certain areas like neurodevelopmental disorder, like managing autism, ADHD, learning disorder, etc., and also stress and anxiety related problems and gut health related problems like IBS, ulcerative colitis, etc., and also autoimmune disorders where there is a role of stress factor in each condition. So start your health journey with Apollo Ayurveda, our new facility at Greams Road, where you will get a personalized comprehensive approach with our precisional evidence-based plan of outcome. Thank you. வணக்கம், என்னோட பேர் டாக்டர் சுஸ்மிதா. ஐ எம் ஒர்க்கிங் இன் அப்போலோ ஆயுர்வேத சென்னை ஆஸ் அ ப்ரைமரி ஃபிசிஷியன் அண்ட் கன்சல்டன்ட். ஸோ உங்கள் முன்னாடி ஒரு சந்தோஷமான வார்த்தை சொல்கிறதுக்கு தான் வந்திருக்குது. எங்களோட புது ஃபெசிலிட்டி அப்போலோ கிரீம்ஸ் ரோடு சென்னையில் புதுசாக ஓப்பன் பண்ண போகிறது. உங்களோட பிரச்சனைகளுக்கு ஆயுர்வேத முறையாக தீர்வு கிடைக்கிறதுக்கு யூ கம் டு அஸ், யூ வில் கெட் த பெஸ்ட் ட்ரீட்மெண்ட் அவுட்கம்ஸ் ஃப்ரம் அவர் டீம் ஆஃப் டாக்டர்ஸ். So once again, we all welcoming all to our new facility. Thank you.
Namaste, I am Dr. Monisha VM, Consultant Physician, Ayurveda Gynecology, Apollo Ayurveda Hospitals, Chennai. Now I have got a great news to you that we are opening in Greams Road, and from there you can get the all authentic Ayurveda treatment and all that holistic approach of Ayurveda to improve the general health as well as the women health, and my services will also be available for to improvement of the women's health. So all of you can come and experience the holistic approach of Ayurveda from Greams Road, Apollo Ayurveda Hospital. வணக்கம், நான் டாக்டர் மோனிஷா விஎம், கன்சல்டன்ட் கைனகாலஜிஸ்ட் அப்போலோ ஆயுர்வேத ஹாஸ்பிட்டல்ஸ் சென்னையிலிருந்து. சீக்கிரமாகவே சென்னை கிரீம்ஸ் ரோட்ல அப்போலோ ஆயுர்வேத் மருத்துவமனையோட இன்னொரு பிரான்ச் ஓப்பன் பண்ண போகிறோம். இங்கே வந்து மகளிர் சம்பந்தമായ நோய்களுக்கும் கர்ப்பிணிகள் மற்றும் பிரசவமான பெண்களுக்கும் சிறப்பான ஆயுர்வேத ட்ரீட்மெண்ட்ஸ் அவைலபிளாக இருக்கும். உங்கள் பிரச்சனைகளுக்கு ஆயுர்வேத தீர்வு வேணும்னா then we are here.
It can be affected one limb alone, like only one hand or only one leg or the entire one side of the body, or it can be a quadriplegia, which is the all four limbs can be affected. Certain conditions can affect the speech. There can be a condition called dysphagia, that means you cannot swallow anything. This usually happens because of two reasons. One is called an infract, which is actually because of a obstruction of the blood supply to certain parts of the brain. It can be because of a simple clot, or it can be because of an embolic clot, something connected with the cholesterol, high cholesterol and all, and it can obstruct the blood flow to the certain parts of the brain, which is actually giving damage to certain parts of the vital areas of the brain, which is controlling the movements as well as the sensory functions. According to which part is affected, the body will reflect usually the impact. There can be two types. One is because of the obstruction, which is called a infract. The another one can be because of a hemorrhage, I mean a bleeding into the brain or intracranial cavity. It can be because of high blood pressure, or it can be because of an infection, or it can be because of a trauma. Ayurveda has got very clear ways and means to identify these two parameters. We also at Ayurveda use the modern parameters like MR angio or MRI brain, Doppler kind of investigations to analyze what is the cause of this. We have treated immediately after the emergency management, the ICU management, for a faster recovery along side by side with the allopathic fraternity of medicine in bringing back the patient with a very faster recovery, and side by side with the physiotherapy along with the Ayurvedic therapy protocol like the Panchakarma therapy, like little bit of Thaila Virajana, Vasti, and where it is applicable we also give a nasal application called a procedure called a Nasyam. And all these parameters along with the treatments like Kerala Ayurveda treatments like Pirichil, Navarakiri, all those things are used actually to restore the neuromuscular functions back, and in chronic cases to restore back the neuromuscular degeneration, the muscular degeneration atrophies and disused atrophies because of the chronicity of the problem, bring back the patient to the near normal lifestyle possible, side by side as an integrative approach as well as an independent approach according to the condition the patient approaches. So we have got a very high rate of success in the recovery rate, and the patient has almost recovered 80 to 90% within a very short span of 40 to 60 days of time. So according to the chronicity of the condition we analyze. For an example, in a hemorrhagic stroke, in an acute condition, the treatments like a Shirodhara or Shirovasti cannot be done because it can cause a vasodilatation, which can again cause a bleeding and a second attack. So in such conditions we do a very critical analysis, what should be done, what should not be done, and we will be doing all the therapies under the supervision of highly qualified senior medical personnel in the therapy room itself, with a very highly trained nursing staff with a good theoretical and practical knowledge and expertise.
coming from New Delhi. My name is Jayashree Thirani, and I would first like to thank the team in Vanagram in the Ayurvedic Center who have made so much of a difference in my life. I have been suffering from a lot of pain and post-operative complexities, and it was only when I came and met Dr. Ajit Kumar in February that I was told what I was suffering from, and I got to know that I had necrosis of the hip as well as shortening of one of my legs due to post-operative changes in my body, and that had created a lot of pain for me, and it was impossible to walk. I was walking with a limp, and for the last 2 months I have taken on to a stick, which is not the best thing because you stop using the limb which is weak. From there on, coming down to the center for 2 weeks, and the therapy is new to me because it's ancient, it's traditional, and it is sometimes not easy to begin with. But as you go on and give it time, you learn to understand how holistically they treat you from within, so that you have the strength to maybe go on and get back your strength in your muscles, your bones, and also mentally you become tuned to the fact that you can get well. Surgery was something which I was just not having an option, and this is something which has given me hope, and I hope others will take the courage of turning to this form of treatment and get well soon. And I'd like to thank all the members, the doctors, the reception, the people who look after me daily, all the assistants, and that I have got, and the love and affection that I have received.